Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy You, Healthy Nation, Healthy World. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And our show today is going to be talking about the transformation of healthcare and where data, information fits into that whole equation. And we have a wonderful, renowned guest speaker with us today, Dr. Paul Grundy, and I'm going to introduce you to Paul. Paul is the Director of Healthcare Transformation at IBM. He is also the President and Director of the Patient-Centered Primary Care Collaborative in Washington, D.C. In addition to his background and his job, he's very renowned because he's the winner of the National Quality Award, a national award that has been given to other notables such as Senator Kennedy and former Governor Rendell. He also is known as the godfather of the medical home. And we talked previously in another program about the medical home, and we will reference some of those points today in this discussion as well. Dr. Grundy trained at the University of California in San Francisco and also at Johns Hopkins University. So thank you again, Paul, for being with us, and I so look forward to this discussion because when we talk about healthcare data, what most people that are thinking about data and information, all they can think about is all the forms that they have to fill out when they say go to a hospital. And then if they have to fill out forms about their health, they're also being asked by many different people to fill out essentially the same form. So I guess people must feel like they're giving a lot of information out. And information is being collected in many different ways, which I'm sure you will be able to tell us about. But I think what we really like to learn today in this show is how is that data being used to transform healthcare, and what value will that be to our viewers?
Well, Dr. Nancy, it's wonderful to be with you. I think that data will do for the doctors' minds and for the patients' minds what imaging has done for their vision.
Improved it.
Improved it.
Transformed it.
Transformed it. I mean, when I started medical school years ago, the transformation that occurred in my lifetime as a physician, the images are now so clear, and you're able to get so much information out of those images that, it's really pretty clear what's going on in terms of an image issue. I mean, data is going to do for our minds what that has done for our vision. I mean, fundamentally, it's going to allow tools like IBM's Watson, right, which can sort through 300 million pages of information, structured and unstructured. So the entire field of medicine, and deliver that to the patient or to the doctor at the point of care, and learn from it, right? So thinking about sorting through all your medical records, all the information that's in textbooks, and delivering that as a clinical decision support to your physician.
So this Watson, is it a supercomputer? How's it work?
So it understands natural language processing, so it understands natural language. Mm-hmm. It can read through structured and unstructured data, so it can read through textbooks, and it learns from it. I mean, it's an artificial intelligence. It's able to actually learn mm-hmm. from that information and grow. So it's fascinating what we're seeing happening. We've already rolled it out in a couple of fields. We started with using it to help WellPoint, a large healthcare plan, better engage the patient in giving the doctor patients permission to go ahead with the procedure. I mean, it's beginning to profoundly impact and change the quality of that, right? So that there's less mistakes being mm-hmm. made, and we're beginning to see that happen across a broader field. We're also using it in oncology up in New York with Memorial Sloan Kettering to begin to get at that. So that's just one example, but another example is being able to mine information, predictively mine information. So we're now beginning to have an investment of some $18 billion that's occurred around medical records, allowing information to be more accessible. Beginning to get at that and mine that information predictively, understand who is likely to be readmitted to the hospital. But even simple things like, healthcare is the last industry that makes you fill out a form every time because it's not structured. It's you go to a hospital and you see 4 different people and you fill out the same form 4 different times.
And it's so annoying. It's annoying for the nurse or the physician who's asking you to fill it out, but it's extremely annoying for the patient and family.
And that is beginning to come to an end because it's pretty primitive now. It's kind of like sitting around in Philadelphia in 1906. And, instead of doctors talking about whether they are going to change to this new system where they actually have data and manage data, it's a bunch of liverymen, and they're talking about whether they should reshoe their horse Daisy or whether they should just keep using this horse Daisy because this newfangled thing that's coming along, there's nowhere to fix it, there's no gas stations, and it's early on in the system of change. But you can see it happening, and in some places it's happened very rapidly. So if you look sort of more globally, both around the United States and globally, I was in a meeting this morning where the folks from Kaiser were talking about how they were using data to engage their patients more effectively.
Now this is Kaiser in California.
This was Kaiser in Southern California. That's exactly right. And there's always been an adage, right, in healthcare that if you work really, really hard, if you really try hard, you can go from that 55% of doing the right thing for the patient that the Institute of Medicine report said a few years ago to 70%. 70% is probably the best you can get. Kaiser just said we're at 85%.
And how did they do it? Did they have
with data?
Did they have Watson?
They don't have Watson, but they have clinical information that is sorted out underneath and gets at the data like any other industry, right? And begins to use that data. I think part of the reason why we're late in healthcare at getting at data and turning it into is because healthcare is so complicated, right?
It is.
It's very complicated. So having tools like Watson, having tools like predictive analytics, having tools that are just now coming online, I think our younger generation, right, the kids in medical school now, the residents of medical school, they're going to grow up in a very different world. In fact, I predict that the whole way medicine is practiced will change. Now, the way medicine is practiced is the doctor is a master builder. Right, so it's an old model that goes back to the Middle Ages. You take something as complex as building a cathedral. You take somebody really bright who stores that information in their head, and at the place where the cathedral's built, that comes out of their head and
they direct other laborers to do it.
In this new world, that isn't going to be stored in that doctor's head anymore because it won't need to be.
Well, there's too much.
And there's too much. So the reason why we increasingly specialize in medicine is because the field of medicine grew so fast that we had to sub-compartmentalize those master builders. So now the model is really very doctor-centric. So you encounter a doctor, that information is stored in their head, they pull it out, and by the way, they're wrong a lot of the time, right? Unfortunately, we end up with a 747 load of patients dying every day with medical errors because it's not really possible to store and retrieve the kinds of information that we need to as complex as healthcare has gotten. So it's very important that we begin to get at the data. In addition to that, coming online is going to be genetic information, right? That's beginning to surface. Very complex tests are now available that are very hard for people to store all that information in their head. That needs the help of tools, just like we use tools in engineering.
Right. Right, but I think the point of, it's too much for any one physician or even a couple physicians to have all the knowledge. I think that part of what you're saying is that, back to your analogy with the glasses, before we had all these tools, people did the best they could with the knowledge that they had. I can remember when I was in 7th grade and I finally got my eyes examination and got glasses. And when I put them on, I just like simply couldn't believe that you could see things that clearly, because I had accommodated. I learned to not sit in the back of the room of the classroom, but to sit in the front of the room. Things that really helped me. So I'm sure in our field of healthcare, people made all those accommodations, but now everybody has access to some degree to these tools. So the question is, how do they get that access, and what are they doing with it? Is everyone at the point of where Kaiser is, or you with IBM using Watson? I mean, how are people accessing these tools?
So first of all, there's been a huge investment that our nation has been made in getting data to doctors, right? There's been the whole revolution of that. I think a total of like $18 billion is being invested in information technology. So it's beginning to come online. But you don't have to think about it as complex or complicated as that. You can really think about it in terms of what a registry would do for you. I mean, if a doctor in your practice kept a list of the tests you needed to be done, and gently reminded you of that, like my vet does with our cat, that alone would begin to improve the quality of care. The likelihood that you would die of breast cancer because somebody didn't follow up with you around that, or colon screening, it would improve. I was recently in a practice in another state, and I was talking to a young physician, and there were 3 names on a whiteboard in the physician's office. And I said, who are those 3 names? She said, oh, those are the 3 women that we've emailed and we've called and we've sent a letter to, and they haven't come to get their breast exam. And so we're asking the community coordinator in this community to drive out to their house and make sure, because we're not going to let anybody die in our community of breast disease, right? I mean, just think of the power of that, right? And it's as simple as that, right? It's just beginning to think about, how can I use information and data in the same way that my bank does, or my builder does, or anybody else in any other industry.
So as people are going to see their healthcare providers in the new structure, as referred to as a medical home, and they fill out all these forms, is that information being transferred into this registry that you're referring to?
Absolutely.
And that way the reminders sort of close the loop and come back to people.
Absolutely. In fact, in a medical home environment, and the consumers here in Philadelphia, because there's many of them that are available here, should really begin to ask their own providers, are you a medical home? Are you going to do this? Sort of managing data more effectively. I mean, one good example is, are they filling out a form 15 times? I mean,
they shouldn't have to.
It shouldn't have to happen anymore. I mean, that should be part of a shift away from paper to managing. I mean, if your doc isn't, pretty far down the road on transforming to using electronic medical records, increasingly more and more docs are having access, allowing you access to that information through your own portal, right? Through your personal health record. I mean, if I was looking for a doc in Philadelphia, I would ask some pretty tough questions about, how can I get better access, better communication, and how are you going to engage me with data? Right.
Well, honestly, I've gone to my own primary care physician, and I still see the endless stacks of paper charts that are sort of pushed into cabinets that look similar to this bookshelf. And I asked this person, I said, when are you going to go to the electronic medical record? And his response was, well, the hospital hasn't given us the money to do it yet. How does it work? Do hospitals finance this for doctors' offices, or are doctors' offices supposed to be buying this for themselves? How does it work?
So the way it currently works is that if you're a primary care provider, you can earn up to $42,000 for migrating to health information technology that's meaningful.
And earn it from whom? Who's paying it?
CMS is paying it. So up to $42,000 from CMS for migrating to medical home, and or migrating to technology that allows you to have information, electronic health records, those sorts of information, registry, that sort of information. And then if you're a meaningful user, i.e. you actually use that to manage your patients more effectively, you really have a reward system that pays you. And by the way, by next year there's going to be a stick after the carrot.
Right.
So you're going to be getting to see a decrease in the revenue that you get if you don't shift
So that's a
away
big
from paper.
incentive
A
for
big
people to
incentive.
do it now. So really, it would be very unusual in the next 12 to 18 months to go into a doctor's office and see a whole bunch of paper charts stacked up.
Oh, I don't think it'd be unusual to see a bunch of papers stacked up, because those doctors are still going to have 20 years of paper records
Right.
that aren't converted to technology.
Good
but
point. So they're going to actually have two systems.
That's right.
That's going to be tough to manage, don't you think?
That's going to be tough to manage. Some practices have discovered that, over a period of 5 years, the information that's in your electronic medical record, you don't very often go back and access the hard paper copies, so they kind of put them in the basement. One practice here, Greenhouse, that I visited in the Philadelphia area, wonderful practice. They had gone to the trouble of actually scanning in all their paper records.
So they went back and retrospectively loaded all that into their new
So
system.
you're seeing both happen, but I think for a period of some years, the old paper records will still be there, and I suspect that they won't disappear overnight, even if your doctor is using
Right.
electronic.
That's a very good point, so that people wouldn't necessarily mistake seeing paper
Yes.
charts for the fact that somebody didn't move to the new electronic system. But you've given us a few examples of really where data makes a difference. So, for instance, you would get reminders of your appointment, which I think is, again, not necessarily the norm. I mean, I make a hairdresser appointment and I get a call 24 hours ahead to find out if I'm going to show up for that appointment. But if you make a doctor's appointment, you don't necessarily get a reminder call. That's just for the appointment. You also gave the example, Paul, that testing, routine screenings, that you're sort of in the system. It knows automatically to call you to remind you of that. But how about some other examples? You told me about a practice that you saw over in Camden that you were very impressed with, and how they've used data to really change the way they deliver care.
Yeah, in fact, Jeff Brennan is sort of a national folk hero now for the work he's done in Camden, New Jersey. As a young physician, he decided to go to Camden and make a difference.
Right.
Because Camden's a place he could make a difference. And he began looking at the data of where patients were coming into the hospital system. I mean, he described today in a meeting that I was at, one patient that I think ran up $3 million worth of hospital and emergency room bills, and it was because nobody was managing that patient, right? I mean, and that happens over and over again. There was actually a TV program and a wonderful article written by Atul Gawande called The Hotspotter, or Dr. Hotspotter, on Frontline, about the experience of Camden, New Jersey, and how they're actually using data to begin to look at who's at risk in the population and begin to manage the population.
So in the biz, these people are often referred to as frequent flyers. So
Yes.
they're trying to find the frequent flyers, and these are not the people with points to actually take a trip. These people have such a track record of constantly going into EDs or coming back for relatively minor things, because why? They don't know maybe how to manage their care, or someone isn't helping them.
Well, these frequent flyers have enough points to take a trip, all right, but it's not the kind of trip that we would want to take.
Right.
It's a trip in and out of the emergency room and in and out of the hospital multiple times. And absolutely, I mean, what's happening is that the system is geared to manage a patient when it comes to the emergency room and not proactively. And so, he began to take care coordinators and nurses and put them right into the housing projects where he was seeing this kind of thing happen, began to proactively manage that population, shifted, I don't know, I think there was a 32% reduction in hospitalization for that population. I mean, just phenomenal.
We'll see, but that really also shows that this person was able to have a shift in mentality. So instead of waiting for the patient to come to him or his practice or his team, he went power to the people. These people can't make it for whatever reasons. And rather than worry about what those reasons are, he went in and actually took care of them right in their own homes.
That's right. And the whole concept of the medical home is to be a proactive, advanced primary care, right? Using data in a proactive way with the registry. And we begin to think about a population as really sort of three populations. We begin to think of those kinds of folks that are acute, that are most likely going to bang up in the hospital. How do you help them not have that happen to them? Because the hospital's a dangerous place.
Right.
You want to stay out of that if you can. And how do you take your next layer of folks down who have some chronic issue and put support around them to engage them so that they manage their diabetes better, they manage their chronic disease better, they lower their risk factors, right? How do you get them exercising? How do you get them incented to take their medication? Data begins to do that at that level. And then the first layer down is the vast majority of the population who are well. I mean, what are the tools you need to put in place if you're a business and you want to keep your employers not becoming chronic? You want to help them with weight reduction, you want to help them with exercise, you want to help them not to develop a risk factor. That's all about productivity, presenteeism, the kinds of things that an employer would begin to think about, because that's 60% of our cost is the lack of productivity.
Right.
So, I think many folks are beginning to think about how you do plan designs for these populations, how do you incent these populations, how do you pay providers differently to deliver that care, and how do you change the practices to be able to practice differently in that kind of environment. Again, data-driven, right? No longer the seat of your pants, no longer waiting till the patient comes in, but actually having proactive registry that follows you home. Again, can be very simple with the patient that's not sick. It might be just reminders of their immunization. But they should, no matter what level of life you are, you should be engaged with that sort of a level.
But let's go back to the frequent flyers for a moment. It just reminds me of how sophisticated we've gotten from, say, a long time ago when I was a public health nurse in Philadelphia, very early on in my career. What we did then was really a much more trimmed down but very similar version, where if a patient hadn't come back to their clinic or a doctor was worried, they would then call the public health nurse, and you had your territory, so you got to know a community and a neighborhood. And we would go in and we would do either the case finding, something where people hadn't even been diagnosed to begin with, or we did a follow-up visit to find out what were the barriers. Why didn't someone go back, and urge them to go back, not urging them, find remedies to how to get them to their clinic appointment or to their doctor. But this is a much more sophisticated version built on those very early tenets, and that is you've got to get the match between people that have serious problems and the treatment team.
And just think about the programs you saw yesterday about Facebook, right?
Tell our viewers specifically what you're referring to.
So there was on TV, they were talking about how Facebook and what you check on the likes and unlikes can tell people who you are.
Right. Your whole profile is stored.
Your profile, right? I mean, what if you actually use that for some good? What if you mined that information and began to actually use that data to intercede on people's behalf to keep them from getting sick?
Right.
I mean, for example, we now know that we can predict a flu outbreak by how fast people Google information quicker than we can, the shoe leather that you did as a public health person.
Right.
Because, if you can take enough information and look at that information and mine that information in ways that we now can, and we actually use that to support you being able to be healthier, or you use it, right? That information is made available for you as the consumer to use. Right. It can really change your life.
But sometimes people are worried when they hear things like that. They fear like maybe their privacy will be violated, or people will have too much information about their illnesses, especially if they're developing a relationship with a wellness program inside with the employer sponsoring it. What's your thoughts on that?
I think they should be worried. I think that a lot of things around healthcare are very private. But I think they should be worried about the right things and not the wrong things.
Okay, give us examples.
The same folks that might talk about and worry about the concern of that would be perhaps the same folks that make it clear who they are on their Facebook page without really understanding that they're making themselves available to who they are on their Facebook page. And I think in one public entity that I saw where legislation was passed around this whole privacy issue, it basically allowed information to flow, and the information that was out there, a doctor could access that information. But if they access that information without your permission, they'd lose their license. They'd go to jail.
So there are rules.
I think if you put rules in place that allow the correct information to flow at the correct time. Now, if you were a doctor in an emergency room and you broke the glass and got that information and it was documented that what you did, great. But that information was available for you to get. Now, if you end up in an emergency room and you're in a coma, the chances are that you couldn't get information about you because it's not available to you.
Right.
But it's there. I can tell you that, if you had access to what information was at your local drugstore about what you were prescribed, the chances are you could find out pretty quickly what was going on and why you were in that coma.
So it sounds to me, really in summary, that we're really on a fast-paced change process here, that with all of the technology that's out there, and tell us a little bit more when I finish trying to sort this all out myself, what the decision support means, because I think that's another crucial piece to this. So there's information that's going to flow between your treatment team, between you as the consumer. More people will have access to that. There will be some rules around it so people cannot get a hold of it that don't need to know that. But how can people expect better care in the future? And that gets to the decision support. Tell us again how doctors and other treatment team members are going to use some of this technology to really make better decisions for the people that are listening to this show.
So again, let's just use the example of Watson. Right?
Okay.
So all of a sudden you have this incredibly powerful tool that can literally sort through the world's literature.
Incredible.
In 0.3 seconds, right? Or a relatively short period of time. And it can learn from that information, and it can deliver that information to your doctor, just like Watson beat the Jeopardy game, right? You saw the NOVA presentation. It can deliver that to your doctor as a differential diagnosis. Now, what that does to the doctor in terms of supporting him, for example, is that we as doctors tend to quite often make the mistake of very early on in the process jumping to a conclusion, and then following that jump to the conclusion down a path that leads us into a rabbit hole.
Speaking of that, I remember talking to a very dear friend of mine that died of brain cancer, and I said to her, what's the one thing you learned from this experience as she was, basically moving out of life? She said, doctors aren't curious enough. They really misdiagnosed her. It was way too late. So this kind of thing potentially wouldn't happen with what you're saying, because doctors wouldn't rule things out too quickly. They would actually see all the different possibilities laid out for a particular set of symptoms.
I would express it slightly differently. I would say it would make it less likely to happen.
Yes, right. There's nothing that's perfect.
Yeah. I think that it can help correct a path that you're going down that's not that's wrong. Again, the way Watson works is it will start from scratch all over again, right? It'll ask a question. The doctor will ask a question back, and it won't take what you've already got and say, now I'm going to look down this path. It'll literally go back through the world's literature again with that new question and ask. It's less likely to go down that wrong path.
It doesn't get tired like people.
That's right. So there's things that it can do, but there's things that it can't do, right? It can't look in your eyes.
Right.
And understand your pain.
It's
it can't hold your hand.
It's a tool.
It's a clinical decision support tool, right? It will help support physicians in better, more quickly diagnosing your problem and make it less likely to go down a rat hole. Figuratively speaking, but it isn't a doctor. It's just clinical decision support. The other things that will we talked about imaging, right? That in some ways that's a clinical decision support tool, right? All of a sudden you have a much clearer picture of what that lung looks like, and that supports your clinical diagnosis and making a decision.
Right.
So that's the kind of thought process we're talking about.
Right. I think that's a really incredibly important interface. Is really nothing is going to take the place of people. A treatment group that's helping you, your physician, nurses, other healthcare providers, because they are the ones that can do still the laying on of hands and make some very good judgments. But having these tools must be very exciting, for doctors and others to really know that they have this that they can access, and that it really can only make their craftsmanship as physicians that much better.
Yeah, as it has in many other industries. I think we're reaching a point, a critical mass, where we're able to manage data in a powerful enough way that we can actually get at some of the complexity of healthcare.
Right.
We've been able to do that for years in banking, right? We've been able to do that for years in engineering. We're just now reaching at a point where we have enough information to do that. The other thing I think that's going to profoundly change the way people practice and the way people engage in medicine is this, right?
The smartphone.
I think mobile, is really going to impact the way care is delivered. I visited again a Kaiser practice in California, where over half of the encounters were now asynchronous. Right? They weren't face to face anymore. They were, there weren't necessarily less face to face encounters, but there were many more and many richer encounters that were occurring online. It was so cool. I sat in a practice where a care coordinator was talking to a patient, right? Following up on a patient with diabetes. And the conversation started off like this. I'm so-and-so, I'm Jane, and I'm calling on behalf of your Dr. Kahana because your Dr. Kahana cares about you. Your Dr. Kahana wants you to know that you need help and da-da-da. The information was imparted. And then the last conversation was, anytime you want to reach Dr. Kahana, anytime, day or night, all you need to do is go to your personal health portal, send an email, and in a reasonable time frame, guaranteed within one day, you'll have an answer, right? So that really enriches communication. My kids, who are 25 and 30, have never seen a teller at a bank.
And probably never will.
They take a picture of,
Right.
and they do everything remotely, and they are completely comfortable
Right.
with that. And in places like Denmark that are a little bit further ahead of us, 82% of the encounters are now asynchronous. We've gone from 157 hospitals in 15 years to 21 in Denmark.
Amazing.
Remote monitoring, right? So, when you take a pill, that information is fed into your cell phone, which is fed into your personal health record, which your doctor knows, if you want him to, right?
It's just dizzying compared to what we're used to. I really think we could go on for so much longer. You can tell that Dr. Paul Grundy is a fund of knowledge and of experience. And I think that what you've told us about today is that knowledge is power, information is power. You are going to have some very decidedly better health benefits as a result of this. Some you may see and some you may not see directly. But nonetheless, as it all comes together, I think that we are going to see tremendous improvement in healthcare as an industry, as a practice, and hopefully a healthier you as a result. Thank you very much, Dr. Grundy, for being with us. It was really a pleasure to have this opportunity to be with you. And I want to thank our viewers for being with us today with this show. Have a wonderful day. Thank you.
Thank you very much.
I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening and join us again. And remember, with health, all things are possible.